Sara Lloyd, founder and CEO of Upper. Thank you so much for interest in becoming a medical director or a visiting clinician with us here today. I'm going to talk about the key differences between these two roles. A medical director at Upper is able to prescribe, diagnose, order, and interpret diagnostics, and is specifically coming aboard to help us improve or create company intakes, also known as our protocols, over time as we continue to grow. We are launching every state with internal medicine in an effort to launch subspecialties underneath internal medicine as we also grow over time. The medical director is also specifically more virtual or remote. That is the primary place of their role because they are joining to actually supervise the clinical staff in their department and in their state underneath them. So because they are helping create or edit or support company intakes and protocols, they are also available to their clinical staff in their department when somebody does have a question or, of course, or a patient has a critical marker and a need that they would need to step in for. But they're also signing off on the diagnostic orders and interpretations that many of the clinical staff joining Upper would not be able to do without them. For example, registered nurses. Registered nurses are one of the highest volume of clinicians that we are seeing sign up for Upper, as they are so excited to join a natural first world. And in a natural first world, there is nothing a registered nurse can't do. Our care is very hands-off and lifestyle focused. It is very non-invasive. And so if the most invasive thing we offer is diagnostics, a registered nurse, like any other clinician joining our platform, can actually start and launch their own practice within Upper as a shared mission and shared brand, see their own patients, and order plans of care. The other key difference is that a medical director, because their primary role is to oversee the clinical staff underneath them, their earnings are structured to earn on that clinical staff's visits as well as the diagnostic orders specifically. Whereas the clinicians who are seeing the patients, out recruiting to and marketing to and acquiring new patients, they are earning on their own time in those diagnostics as well, but they're also earning on every single item in a plan of care, such as the specialty care or specialty therapies that they are referring those patients to, which could include services like dietitians, physical therapists, and so forth. The medical director's earnings are on the clinician time and the diagnostics under their license. The clinicians underneath them earn on the actual patient care happening at all times. Upper is not an affiliate company nor an affiliate program, and earnings are structured very linear. Nobody is earning on a doctor bringing on another doctor or a nurse bringing on another nurse. The physicians or medical directors specifically earn on the clinical staff underneath them. Those staff earn on their patients' care and plans of care. Now let's talk about the visiting clinician. Just because somebody is a visiting clinician does not mean they can double as a medical director, but a medical director could double as a visiting clinician if they chose to see patients on their own time and on their own in their own department and so forth. They can choose to do that in addition to their medical directorship. A visiting clinician is not supervising any clinical staff underneath them. They are specifically contracting with Upper to recruit their own patients and see Upper patients in a natural first approach in that shared brand and mission, but of course on their own time, where they are also earning on the full plan of care that they are creating to and offering that patient. But the two main differences between the time and the earnings is that a medical director is primarily virtual, supervising clinical staff underneath them, and earning on the clinical staff underneath them, where the improved success as well as volume of their clinical staff in their department and their state scales their earnings more and more. And then we come over to a visiting clinician who will primarily be in person or virtual if they choose, and they are only earning on their own time and their own patient load and their own plans of care. I hope this helps you better understand what it's like to become a medical director or a visiting clinician, and we are so excited to see your sign up and get to meet you soon. Thank you.